There's so many memorable moments that we have with our patients because we are part of the most private moments in their lives. There's two specific moments that come to my mind. One of them is a patient that I happened to deliver her 3 children. It's a little bit unusual given that we're a large group, and I happened to be there for the delivery of her 3 kids. It was wonderful. We got to establish this care and this relationship over time. She gave me, on her postpartum visit, she brought me a crystal star that said, "Thanks for being our hero," and the name of her 3 children. That was just like, it happened to be very unusual, and very happy that I was there for the delivery of her 3 kids. And there was another moment. I was in one of the offices. All of a sudden, there was a patient that came to schedule an appointment, and she was not scheduling an appointment with me. She happened to run out of the office and then come back like 20 minutes later. She happened to pull me aside and give me a card. And she said, "You may not remember me, but her card said, thank you for taking the time to help me make the right decision." And this was a patient that had an unexpected pregnancy, unplanned pregnancy, and was very confused of what to do. She happened to decide to have her kid, and her baby was already 2 years old. So when she saw me, she ran out of the office just to go get me the card and have the moment to say, "Thank you for taking the time, because that's the best decision I've made in my life." So those were moments that kind of like got stuck to my head, and then I feel like what we do, you can have a significant impact in somebody's life. Like if you really take the time to listen and to try not to just do medicine, but be very human about what we do. I try, I'm not gonna say it happens every time, but I certainly can tell a big difference when I do it. I try to start my day, even when I'm driving in the car, like on the way to the office, start my day with prayer. I listen to the gospel of the day. There's a Colombian priest that has always reads the gospel of the day, and that's a beautiful reflection afterwards. So when I start my day like that, it doesn't matter what the day brings. No matter if it's hard or not, I find the right words to say of encouragement for patients, or to just go through the day like not feeling defeated, even if it's a hard day. And I can tell the difference when I don't do it, when I'm like, just running and, just drinking my coffee and then rushing to the office, and then I forget to pray, or like I just don't do that. I can tell. I'm sometimes feel like emotionally drained at the end of the day, or feeling upset about something. So that certainly makes a difference when I start my day like that. I firmly believe that we all women are caregivers. We always put everybody else ahead of us in terms of medical appointments, healthy eating, keep everybody happy in our families and healthy, but we are the last in the list. So I always try to tell my patients to really put a priority to love themselves. If you love yourself and you take care of yourself, you're gonna be able to care for other people in a healthier way, emotionally, without being like a burden. Take care of your medical needs, eat healthy. If you love yourself, you're gonna have time to exercise, to have some time for your own sanity, for prayer, for all of that. That's, I think, is the most important thing.